My name is Brad Culling, and I'm a board-certified anesthesiologist and interventional pain physician. So I try to approach different treatment plans for different types of pains by formulating a very unique treatment plan. I think each and every patient has their own story. They have their own sort of way that they developed chronic pain. And so I think it's important to really dive into that and figure out kind of how it all started, what the process was for it to begin, and also get a good sense for what their home environment is like, what their family environment's like. That way I can really get a good sense for the treatment plan for them, because chronic pain is very complicated. And so I think it's important to understand all those aspects of someone's life to really get a good treatment plan for them. The advancements in pain management that I'm most excited about, I would have to say, would be the field of neuromodulation. In particular, spinal cord stimulators, peripheral nerve stimulators. That's some of the newer technology that's out there now that I think has really been shown to be the best long-term treatment plan for patients with chronic pain, whether it's chronic neck pain, back pain, chronic knee pain. While medications and other interventions can be helpful, I think things like spinal cord stimulators and peripheral nerve stimulators can really benefit patients much greater than medications, and it can last much longer. A success story where my treatment really improved a patient's life would have to be my patients, not one in particular, but I have several patients who have had spinal cord stimulators implanted for chronic back pain after having several surgeries. These patients had been on chronic opioid therapy for many, many years. And I have patients who have gone on to get the spinal cord stimulator implant done and who have gotten off of all of their medication. I think that's probably the biggest sort of home runs and treatment successes that I've had over the years. The advice I have for patients seeking relief from chronic pain would be to never give up. I think a lot of patients, because chronic pain can be so frustrating and it is something that never goes away, I think a lot of patients lose hope and they do give up on finding the right doctor, finding the right clinic, or finding the right treatment that can be helpful. And so what I would say to them is, keep looking around, keep talking with healthcare providers, and find someone that can really tailor their treatment to their specific needs. If you're in pain, there's no need to wait. Advanced pain care. The pain stops here.